At 3:14 a.m., after 5 flawless surgeries in 3 hours, the chief of surgery stood behind the glass and whispered the only question left. "Who are you?" Because the woman below him wasn't supposed to be extraordinary. She was a temporary surgeon in faded scrubs, worn-out shoes, and a badge nobody bothered to respect. Just hours earlier, they had told her to stay in her lane, take the easy cases, and not make trouble. But then the trauma calls came in. Ambulances screamed through the El Paso night. Blood hit the floor. Monitors started failing their rhythm. And one quiet doctor moved through the chaos like she had survived worse places than any hospital hallway. Stay to the end, because this is not just a story about surgery. It is about being underestimated, staying calm under fire, and proving your worth when everyone is watching. Like the video and comment where you're watching from. 3 hours before Garrett Rourke whispered that question through the glass, Coyote Ridge Medical Center looked like any other hospital trying to survive the dark. It sat on the eastern edge of El Paso, where the city lights thinned into desert, and the wind carried dust against the ambulance bay doors. At midnight, the front lobby was quiet enough to hear the vending machines hum. A security guard sat behind the desk with one hand around a paper cup of coffee, watching weather radar crawl across a muted television. Somewhere above him a newborn cried. Somewhere below him a boiler knocked inside the walls like a tired heart. The hospital was not asleep. Hospitals never slept. They only lowered their voices. On the 3rd floor, outside surgical services, the lights were too bright and too white. They made every face look older. They sharpened the shadows beneath tired eyes and turned the waxed floor into a pale mirror. The air smelled of disinfectant, old coffee, warm plastic, and the faint, metallic scent that never fully left a place where blood was handled for a living. Dr. Garrett Rourke stood in front of the surgical schedule board with a black marker in his right hand. He had been standing there for almost 7 minutes without writing anything. A column of names ran down the board. Procedures, room assignments, delays, cancellations, notes in red, notes crossed out, notes rewritten by people who had stopped believing a schedule was a promise. Rourke was 52, broad-shouldered, sharp-eyed, and built like a man who had learned early that softness could be mistaken for weakness. His hair was silver at the temples. His jaw carried a day's worth of stubble. His white coat was clean, but the collar of his shirt had started to wilt. He was not looking at names. He was looking at pressure. OR1 had a bowel obstruction that should have gone up 4 hours ago. OR2 was still occupied with a complicated hernia repair that had turned ugly. OR3 was open, but only barely staffed. OR4 had been down for maintenance for 11 days because someone in administration had decided replacement parts could wait until the next budget cycle. The waiting room had patients who had been told to be patient. Rourke hated that phrase. Patients were patient until their pressure dropped, until their fever climbed, until the pain stopped being a complaint and became a countdown. He uncapped the marker, capped it again, then pressed the tip against the board beside a postponed appendectomy. No ink came out. He stared at it like the marker had personally failed him. Behind him, the double doors opened with a soft hydraulic sigh. Jenna Pike walked in carrying a tablet against her chest. She moved the way good charge nurses moved at night, quickly, but not hurried, reading the hallway with one glance. She saw the resident asleep upright at the computer station. She saw the scrub tech rubbing one wrist. She saw Rourke's shoulders and knew he was already calculating who he could push, who he could not, and who would break if he asked for 1 more hour. Jenna had worked at Coyote Ridge for 9 years. She had seen surgeons with gifted hands and rotten tempers. She had seen administrators speak in numbers over patients they had never touched. She had seen nurses cry in supply closets and return to the floor with dry eyes because the call lights did not care. She stopped beside Rourke. The agency surgeon checked in. Rourke did not turn. Name: Dr. Mara Keene. The marker squeaked under his thumb. Credentials: board certified. General surgery. Trauma privileges. Clean license. Staffing cleared her through HR. Rourke gave a short breath that was almost a laugh. HR clears paper. Jenna waited. Rourke finally looked at her. I clear rooms when paper gets somebody killed. Jenna did not flinch. She knew better than to take his tone personally. Rourke's anger usually had a patient's face behind it. She is in the scrub area. How late? 10 minutes. Why? She drove in from Las Cruces after another assignment. Rourke's eyes narrowed. That is not comforting. No, Jenna said, but she is here. He looked back at the board. Put her on simple cases. Gallbladders, appendixes, nothing unstable, nothing with vascular risk, nothing pediatric. We are thin. I can read the board. I know you can. I am telling you the board is lying. The ER is holding 3 surgical consults already. Dr. Bell is tied up. Sutton is covering consults and half ignoring them. Liao is still in OR 2. We have 1 open room and 1 temp surgeon. Rourke turned toward her fully. This hospital does not become a courtroom because we are tired. Jenna's mouth tightened. This hospital becomes a morgue when we pretend tired is the only problem. For a moment, the hallway seemed to hold its breath. Rourke looked at her for 1 long second. He respected Jenna. That was why her honesty irritated him more than anyone else's. Show me the temp. He walked before she could answer, and Jenna fell into step beside him. They passed framed photographs of former Chiefs donors, board members, and smiling people holding ceremonial scissors at ribbon cuttings. The photographs made Coyote Ridge look orderly, polished, funded, certain of itself. The night beyond those frames told a different story. A resident rushed past with a stack of consent forms tucked under one arm. A nurse pushed an empty stretcher so fast, one wheel rattled. Somewhere down the hall, a patient coughed with a wet, broken sound that made Jenna turn her head. Rourke kept walking. At the scrub area, the door was half open. Inside, Dr. Travis Bell leaned against the counter sleeves' rolled posture loose enough to look careless and confident enough to look rehearsed. He was handsome in the way hospital brochures liked clean jaw, bright eyes, the easy smile of a man used to being forgiven before he asked. Dr. Paige Sutton sat on a low stool near the lockers, scrolling through her phone. Her dark hair was tucked into a cap. Her badge hung from one pocket. She looked bored, but her eyes moved too often for boredom. Paige noticed everything. She just preferred not to look impressed. Near the sink stood a woman with both hands under running water, Mara Keene. At first glance, nothing about her demanded attention. She was average height, lean, with her hair pulled back so tightly it gave nothing away. Her navy scrubs were clean but faded from too many washes. Her shoes were old, the soles worn at the outer edges. She wore no earrings, no necklace, no watch with a flashy face. Her badge clipped flat against her chest. By the wall sat a black duffel bag. It looked battered. One corner had been stitched by hand with thick, dark thread. The canvas was scratched white in places as if it had been dragged across concrete. Rourke saw the bag, then the shoes, then the face. Mara shut off the water with her wrist and turned. Her eyes were clear. Not eager, not defensive. Just present. Dr. Keene Rourke said. Yes, I am Garrett Rourke, Chief of Surgery. I know. Bell's smile widened. Good start. Mara did not look at him. Rourke stepped into the room. You are our agency coverage. I am. We are short tonight, which means people will be tempted to be creative. I dislike creative when I do not know who is holding the scalpel. Mara picked up a towel and dried her hands carefully. Understood. Bell pushed off the counter. No offense, Dr. Keene, but we were expecting someone with a little more polish. Mara folded the towel once and placed it in the bin. None taken. Paige looked up from her phone. Where did you train? A few places. Bell gave a quiet chuckle. That usually means no place long enough to brag about. Mara's expression did not change. It means I worked where I was needed. Rourke watched her while she spoke. Her voice was even, low. No performance in it. No need to dominate the room. That bothered him more than swagger would have. Swagger was easy to classify. Quiet competence was harder. What is your specialty? Paige asked. Trauma. Bell lifted his eyebrows. Everybody is trauma when the form asks. Mara looked at him then. Not sharply, not coldly, just directly. Belle's smile thinned by a fraction. Rourke stepped closer. This is not a place to prove yourself. You work inside your privileges. You ask if you are unsure. You do not improvise because something looked dramatic in another hospital. You do not turn my OR into a personal audition. Mara held his gaze. I am not auditioning. Good. I am here to work. The words should have been ordinary. They were not. Jenna heard something under them. Not pride, not resentment. Something flatter and heavier, like the sentence had been stripped down by years of being true. Rourke pointed toward the hall. You will start in OR3. Routine laparoscopic cholecystectomy. Middle-aged male. Stable. Dr. Shaw is anesthesia. Mara nodded once. Any complications on imaging? Rourke paused. It was the first question she had asked. Minimal inflammation. No ductal dilation. No prior abdominal surgery. Labs. Jenna answered before Rourke could. White count elevated. Liver enzymes acceptable. Coags normal. Mara looked at Jenna. Blood type. Rourke's eyes sharpened. For a gallbladder. Mara did not turn her head. For a patient. The room went quiet just long enough for the statement to land. Belle pushed air through his nose. Relax, it is a gallbladder, not a battlefield. For the first time, something moved across Mara's face. Not enough to name. Then it was gone. Rourke caught it anyway. Type and screen is in the chart, Jenna said. Mara nodded. Thank you. Rourke folded his arms. You expecting trouble? No. Then why ask? Mara picked up her cap. Because trouble does not care whether we expect it. Page stopped scrolling. Belle looked amused, but less than before. Rourke studied Mara for another beat, then turned toward the door. Or 3. Keep it clean, keep it routine. Mara said nothing. Rourke walked out. Jenna waited half a second, then looked at Mara's duffel bag. Do you want me to have that put in a locker? Mara lifted it before Jenna finished the sentence. It came off the floor with weight, not clothes, not only clothes. I will keep it close. Jenna did not ask what was inside. Good nurses knew which questions were useful and which ones only made people close doors. They walked together through the surgical corridor. Behind them, Belle spoke softly enough to pretend he was not trying to be heard. Agency temps with mystery bags, always a good sign. Page answered without looking up. At least this one knows where blood types live. Belle laughed. Mara kept walking. The corridor opened into the main surgical wing. Nurses moved between rooms with the focused speed of people doing 3 jobs while remembering a 4th. The floor gleamed, but old scuffs showed beneath the polish. Monitors chimed behind closed doors. A printer near the desk spat out pages no one had time to read. Jenna pointed as they moved. Or 1 is our biggest room. Or 2 is still occupied. Or 3 is yours. Or 4 is dead until engineering stops lying to me. Sterile supply is north. Blood bank is 1 floor down, but if you need units fast, call me and call them. Do not trust the phone tree. It was designed by someone who has never been in a hurry. Mara listened. Her eyes tracked doors, carts, signs, badge readers, oxygen ports, linen bins, the crash cart location, the distance from the elevator to the OR doors. Jenna noticed. You are mapping. Yes, most people wait until they are lost. Mara looked toward the end of the hallway. I do not like being lost with a patient moving. Something about the sentence made Jenna slow half a step. You have done a lot of nights like this. Mara's gaze passed over a group of residents clustered around a workstation. One of them was eating crackers from a glove box lid. Enough! That was all she gave. They reached the supply room. Jenna opened it with her badge. The room smelled of cardboard sterile wrap and plastic. Shelves rose on both sides, stacked with suture packs, drapes, laparoscopic trays, suction tubing, gauze, gowns, gloves, and boxes labeled in black marker by people who knew the official labels were never where you needed them. Mara stepped inside and scanned the shelves. She did not touch much. A suture packet. a vascular clamp tray label, a hemostatic dressing box. She checked returned, moved on. Jenna leaned against the doorframe. You are cataloging. Yes. Should I be worried? Mara looked at a shelf where trauma supplies should have been fuller. Not yet. Jenna followed her gaze. We have had supply gaps. How long? Depends who is answering. Officially temporary. And unofficially, Jenna gave a tired smile with no humor in it. Long enough to stop feeling temporary. Mara crouched and checked the lower shelf. Who controls restock priority? Materials management. Unless a surgeon yells loudly enough, then administration pretends it was already approved. Mara stood, and Rourke yells. Rourke fights. There is a difference. Mara looked back through the open door toward the hall. He cares. Jenna studied her. You got that from 5 minutes of being scolded. Yes. How? He is angry at risk, not people. Mostly. Jenna almost smiled. Mostly is doing a lot of work. For the first time, Mara's mouth shifted slightly. Not quite a smile, but close enough to prove she knew how. A call bell sounded somewhere down the corridor. Then another. Jenna checked her tablet. Your gallbladder is in pre-op. Henry Dale. 51, nervous talker. Try not to let him sign his own discharge from fear. Mara looked toward the door. Any family. Wife in the waiting room. She keeps asking if he is going to be okay. Has anyone answered her? Jenna paused. We have been busy. Mara's eyes moved to her. Jenna felt the correction before Mara spoke. Mara did not speak. That made it worse. I will send someone, Jenna said. Mara nodded once. They left the supply room and moved toward pre-op. At the nurse's station, Dr. Caleb Shaw stood over a chart with a cup of coffee in one hand and a pen in the other. He was in his early 40s, calm-faced with tired eyes behind clear lenses. His hair had started to gray at the front. He had the stillness of a man who had learned that panic wasted oxygen. Jenna stopped. Caleb, this is Dr. Mara Keene. She has OR3. Shaw looked up. His eyes moved over Mara, once not judging, only registering. Nice to meet you. Mara Keene. Caleb Shaw. I will keep him breathing if you keep him from needing too much help. Fair arrangement. Shaw's mouth moved slightly. That was his version of amusement. Rourke appeared at the far end of the corridor speaking into a phone. His voice was low but hard. No, I do not care that the vendor said Monday. Monday does not operate on patients tonight. Find the part. He ended the call and saw Mara with Shaw. His expression tightened by habit. Keen. She turned. Yes. Dale is routine. No surprises. Mara held his gaze. Surprises are rarely scheduled. Shaw looked down at the chart to hide his reaction. Rourke did not smile. Do not make me regret letting you touch even a routine case. Mara answered quietly. I do not plan around your regret. Jenna felt the air change. Bell, passing behind them, stopped just enough to hear. Rourke stepped closer. What does that mean? Mara's voice stayed even. It means I plan around the patient. For a second, Rourke looked like he might snap back. Instead, he looked at Shaw. You call me if anything looks wrong. Shaw nodded. Of course. Rourke walked away, but not far. Jenna saw him stop at the board again, pretending to read it while listening. Bell moved beside Paige Sutton near the workstation. She is either good, Bell murmured, or exhausting. Paige watched Mara head toward pre-op. Those are not mutually exclusive. In pre-op, Henry. Dale lay under a thin blanket, fingers worrying the edge of it until the fabric bunched in his hand. He was broad-faced, pale under the fluorescent lights with the frightened cheerfulness of a man trying to convince strangers and himself that everything was normal. His wife sat beside him in a plastic chair holding his wedding ring in both hands. When Mara entered, Henry looked at her badge first, then her face. You are the surgeon. Yes. You look young. I am older than your gallbladder problem. His wife laughed once before she could stop herself. Henry blinked, then laughed too. The room loosened by 1 degree. Mara stepped closer. Mr. Dale. I am Dr. Keene. We are removing your gallbladder because it has become inflamed and is causing pain. We expect a laparoscopic procedure. Small incisions. Camera. Instruments. If anything looks unsafe, we adjust. Henry swallowed. Adjust how? Carefully. His wife leaned forward. He has been pretending not to be scared. I have not, Henry said. Mara looked at him. Being scared is allowed. Moving during surgery is not, so Dr. Shaw will handle that part. Shaw entered behind her. I have an excellent record against moving. Henry managed a weak smile. Mara checked the chart, then looked at the wife. We will update you when he is out. The woman nodded, but her eyes were wet. He hates hospitals. Mara's expression softened, almost imperceptibly. Most honest people do. Henry looked at Mara's hands. You have done this a lot. Yes. How many is a lot? Mara glanced at his monitor. Enough that tonight your job is simple. Breathe when Dr. Shaw tells you. Let us do the rest. Henry stared at her. Something in her voice worked. Not warmth exactly, certainty. He nodded. Okay. Mara signed the final line and handed the chart back. As she stepped out, Henry's wife spoke. Doctor. Mara turned. The woman's voice lowered. He has 2 daughters. Mara held her gaze. I understand. She did not say he will be fine. She did not hand out comfort she could not guarantee. The wife seemed to respect that more. In the hallway, Jenna caught up with Mara. You are good with families. No, you are. Mara looked ahead. I am honest with families. Sometimes they mistake that for good. Jenna watched her profile. There was no self-pity in the words. Just fact. They reached OR3. The room was being prepared. Stainless steel gleamed beneath the lights. Blue, sterile drapes waited, folded on the table. The laparoscopic tower stood ready, screen dark. The scrub tech counted instruments with quiet precision. A circulating nurse checked labels twice, lips moving as she read. Mara paused just inside the doorway. Not dramatically, just long enough to take in the room. Airway at head, suction position, cautery, camera, backup tray, blood access, exit path. Jenna saw the scan happen. Again. You really do not trust rooms, she said. Mara stepped toward the sink. I trust rooms after I know what they have. Jenna leaned near the doorway. And people. Mara began scrubbing. That takes longer. The water ran over her hands. She scrubbed with a method that was not rushed and not slow. Every movement had purpose. Fingers, nails, wrists, forearms, ritual as discipline, not habit. Jenna stayed. She had planned to leave, but something kept her there. Maybe it was the way Mara stood. Maybe it was the duffel bag resting outside the wall within sight. Maybe it was the fact that Rourke from 30 feet away was still pretending not to watch. Bell walked past the OR entrance with a chart in hand. Enjoy the scenic route keen. Gallbladders can be very demanding if you let them. Mara did not stop scrubbing. Patients usually are. Bell's smile faded for half a second. Then he kept walking. Paige Sutton followed a moment later, slower. She glanced into the room and watched Mara's hands. You always this calm. Mara rinsed. No. Paige waited. Mara shut off the water with her wrist. I just do not find panic useful. Paige looked as if she wanted to answer, then decided against it. Jenna handed Mara a towel. The patient rolled in soon after. Henry was quieter now. Fear had burned through his jokes. His eyes found Mara as soon as she entered the room. You are still here, he said. Mara stepped beside him. Yes. Good. Shaw adjusted the monitors at the head of the bed. Mr. Dale, I am going to give you some oxygen first. Nice, deep breaths. Henry obeyed. The circulating nurse began the formal timeout. Patient name, date of birth, procedure, allergies, antibiotics, correct site. Mara listened like every word mattered. Rourke appeared at the door during the timeout. He did not enter. He stood with arms folded, eyes moving from Shaw to the scrub tech to Mara. When the nurse finished, Mara said, "Thank you." The scrub tech glanced at her. Surgeon said many things before incision. Commands, complaints, jokes, silence. Thank you was less common. Shaw noticed too. Rourke noticed most of all. Mara positioned herself. The room settled. The first incision had not yet been made when a faint sound rose from somewhere below them. A siren. distant at first, thin against the glass and concrete. Then another, closer. Jenna, still outside the door, looked down the hallway toward the trauma elevators. Rourke turned his head. For one suspended second, nobody moved. The sirens grew louder, cutting through the El Paso night, climbing toward Coyote Ridge, with the steady hunger of something that had already happened and was now arriving for witnesses. Mara looked at the monitor, then at Henry Dale, then at the tray in front of her. Her voice was calm. Scalpel. The word landed softly, but the room obeyed it. The scrub tech placed the instrument into Mara Keene's waiting palm. No slap of metal. No wasted motion. Just a clean handoff under white surgical light. Henry Dale lay still beneath the drapes, his face hidden except for the tube secured at his mouth and the strip of skin visible above the blue field. Minutes earlier, he had been a nervous man, asking whether his surgeon had done this before. Now, he was a body under anesthesia, warm and vulnerable, trusting strangers to keep the line between routine and disaster from moving. Dr. Caleb Shaw stood at the head of the table, eyes moving between the monitors and Henry's face. "Vitals are stable," he said. Mara nodded once. She made the first incision. There was nothing dramatic about it. That was what caught Shaw's attention first. Some surgeons made even small cuts feel like declarations. Mara did not. Her hand moved with quiet economy, opening only what needed to be opened, no more, no less. The laparoscopic camera came alive on the monitor. Pink tissue shining under the lens. The hidden landscape of a human body filling the screen like terrain seen from a low, flying aircraft. Mara's eyes lifted to the image. Camera steady. The resident holding the scope adjusted too quickly. The image jumped. Mara did not raise her voice. Smaller movements. The resident swallowed. "Yes, doctor." The image steadied. Shaw watched Mara's hands. He had spent 15 years standing at the edge of other people's precision. From anesthesia, you learned surgeons the way sailors learned weather. Some were storms. Some were knives. Some were noise wrapped around skill. Some were skill wrapped around fear. Mara was something else. She did not fill the room. She lowered its temperature. Outside the OR, the sirens grew louder, then stopped. That was worse. A siren in motion still belonged to the street. A silent ambulance outside the bay meant the problem had arrived. Jenna Pike stood beyond the glass, one hand on her tablet, looking down the corridor. Her jaw tightened as the overhead speaker crackled. Trauma team to Bay 1. Multiple incoming. Trauma team to Bay 1. Rourke, still at the doorway, turned toward the voice. The circulating nurse glanced at him. Shaw glanced at the monitor. Mara did not glance anywhere. "Stay with the case," she said. The words were not loud, but everyone heard them. The gallbladder came into view inflamed, but not dangerous. The anatomy was clean. The duct was where it should be. No scar tissue, no surprise bleeding. Exactly the case Rourke had chosen for her because he believed a temporary surgeon should begin where the hospital could afford a mistake. Mara did not treat it like a lesser case. She dissected with the same attention she might have given a ruptured vessel. Clip placement. Tissue tension. Field visibility. Every step had a reason. Every pause had a purpose. Rourke watched from the door, annoyed by the fact that he could find nothing to criticize. Belle appeared beside him, pulling a trauma gown over one arm. "You still babysitting the gallbladder?" Rourke did not look at him. "I am watching my room." Belle glanced at the screen. "She is not terrible." Rourke's mouth tightened. "That is not a credential." Belle laughed under his breath and moved away. Another overhead call followed before his footsteps faded. Trauma. Bay. To prepare for arrival. Trauma. Bay. To prepare for arrival. Jenna stepped closer to the OR door. "Garrett." Rourke turned. Her voice was low. "Dispatch says 2 motorcycles under a freight trailer. 1 sedan rolled, trying to avoid it. We have 5 confirmed, maybe 6. 3 critical." Rourke's eyes hardened. "Who is in Bay 1? Belle is heading there. Page is coming from consults. Liao is still scrubbed. Peds is thin. What about ortho? On call is 10 minutes out." Rourke swore under his breath. Inside the room, Mara clipped the cystic duct. The monitor tone stayed steady. Shaw looked toward her. "You hear that?" "Yes." "You want an update?" "No." He looked at her more closely. Mara kept working. "If they need me," she said, "they will say my name." Jenna heard it through the door and felt a strange flicker of recognition. Not of Mara, exactly. Of a type. People who had worked around real catastrophe did not chase noise. They waited for the signal inside it. Rourke stepped into the room just past the threshold. Keen. Mara's eyes stayed on the screen. "Yes. You finish this case. Then you wait for assignment." "Understood." "You do not self-deploy to trauma." "Understood." The fact that she did not argue irritated him. He had been ready for defiance. Defiance he could manage. Calm agreement gave him nothing to push against. Mara separated the gallbladder from the liver bed with a precise rhythm. The scrub tech adjusted before she asked. The resident holding the camera stopped overcorrecting. The circulating nurse moved less nervously. The room had begun to follow her. That bothered Rourke too. No one should command a room that quickly, especially not someone no one knew. The trauma pager screamed from the wall, a harsh tearing sound. The resident flinched. The camera twitched. Mara's voice cut through the room. Still, the resident froze. The image steadied again. Mara did not look angry. That was somehow worse. "Panic outside the field," she said, "never in it." Shaw's eyes moved from the monitor to her face. There was no performance in the sentence, no lecture, no pride. It sounded like something learned the hard way. Mara irrigated, checked for bleeding, and waited one beat longer than most surgeons would have. The field remained clean. Close. The scrub tech was ready. From incision to closure, the case had taken less time than Rourke expected, but nothing about it looked rushed. The stitches were neat. The dressings clean. Henry Dale's pressure never wandered. Shaw looked at the clock. His eyebrows lifted slightly. Mara peeled off her gloves. Recovery. Standard post-op orders. Watch nausea. Let his wife know before she wears a hole through the waiting room floor. The circulating nurse nodded quickly. "Yes, doctor." Rourke stepped farther into the room. "How long?" Shaw answered before Mara could. 27 minutes skin to dressing. Bell passing outside stopped. "What?" Shaw did not repeat himself. Mara turned toward the sink. Rourke stared at the clean field, then at Henry being prepared for transport. A routine case. A clean case. A fast case. It should have reassured him. It did not, because skill was easiest to trust when it appeared gradually. Mara's had arrived without introduction. Jenna appeared in the doorway, breathing harder now. "Garrett Bay. 2 needs a surgeon." Rourke turned. "Who is the patient?" "Female, mid-40s. Motorcycle passenger. Open lower extremity fractures. Pressure trending down. Possible abdominal injury. Least critical." "That is the least critical." Rourke looked once at Mara, who was still washing her hands. He spoke carefully. "Keen. Trauma 2. Assessment only until I say otherwise." Mara shut off the water with her wrist. "Yes, doctor." Rourke stepped closer. "I mean it." Mara dried her hands. "I heard you." She moved past him with Jenna at her side. The hallway had changed while they were in surgery. Hospitals did that. One minute, a corridor was polished floor and quiet carts. The next, it became a river of bodies, wheels, alarms, blood, and voices trying not to sound afraid. A respiratory therapist ran with an oxygen tank hooked under one arm. A nurse pushed a rapid infuser cart so fast the tubing swung loose. 2 residents argued over imaging until Jenna pointed once and both of them moved. The elevator doors opened. A paramedic backed out, first walking fast, one hand pressing down on a blood-soaked dressing. Behind him came the stretcher. The patient's face was gray under streaks of road dirt. Her left leg was wrapped in a temporary splint, but the shape beneath it was wrong. Too much angle. Too much swelling. Too much red through gauze that had already lost the fight. A second stretcher rushed past toward Bay 1. Male. Massive abdominal trauma. Someone was performing compressions while they moved. Rourke went with that one. His voice snapped down the corridor. Bay 1, move, Bell with me. Mara did not watch him go for more than a second. She turned into Trauma Bay 2. The room was waiting but not ready. There was a difference. Mara saw it immediately. The airway cart was against the wrong wall. Suction tubing was coiled but not connected. The trauma shears were missing from the tray. The warm blankets had not arrived. The tourniquet drawer was empty. Jenna saw Mara's eyes move and felt heat rise in her own face. We are usually better than this. Mara crossed to the suction line and connected it herself. Usually is not here. A young trauma nurse stepped in. Do you need something? Mara checked the airway drawer. 4 tourniquets. 2 pressure bags. Blood warmer primed. Large bore access both arms. Call blood bank and tell them to stage 6 units. The nurse blinked. 6. Jenna answered for Mara. Do it. The nurse ran. The stretcher rolled in. Carla Vance, the paramedic, said fast. 46. Passenger on motorcycle. Struck and dragged. Open femur and tibia fib fractures left side. Helmeted. No loss of consciousness reported. BP was 100/60. Now 86/50. Heart rate 132. Left foot cold. We gave fentanyl fluid, started bleeding, partially controlled. Mara moved to the bedside. Carla. The woman's eyes rolled toward her wide with pain and terror. Am I dying? Mara placed 2 fingers against her wrist. The pulse was fast and thin, not if we move correctly. Carla's lips trembled. I cannot feel my foot. Mara looked at the leg, then at the monitor, then at the dressing. She did not pull anything open yet. She read the patient first. Jenna, call ortho. Tell them not to take 20 minutes. Already paging. Page again. Jenna did. Mara lifted the edge of the splint enough to see the foot. Pale. Cool. Bad. She pressed for a pulse. Nothing she liked. The young nurse returned with tourniquets and pressure bags. Mara took 1 tourniquet and set it within reach, not applying it yet. The nurse noticed. You want that on. Not unless we have to choose between the leg and the life. The paramedic stared at Mara. Something moved across his face. Recognition, maybe. Or confusion. Mara did not see it. Her focus was fully on Carla. 2 IVs, Mara said. Type and cross. Trauma panel. Portable pelvis. Fast exam now. Shaw entered behind her, still tying his mask. I thought you were on the gallbladder. Finished. He took 1 look at Carla and moved to the head of the bed. Airway is okay for now. Pain is driving her pressure too. Control it without stealing her breathing. I can do that. Mara's hand moved to Carla's abdomen. Gentle pressure. Watch the eyes. Watch the breath. Watch the flinch that came before the sound. Carla cried out when Mara pressed low on the left side. Mara looked at Jenna. 4. Jenna did not hesitate, but Rourke's order still hung in the air. He said assessment only. Mara's eyes stayed on Carla. She is bleeding, losing perfusion to the foot, and heading into shock. Assessment is over. Jenna held her gaze for half a second. Then she turned. Or 3 needs turnover now. Trauma case, move. The young nurse looked startled. Do we have approval? Mara leaned closer to Carla. Carla, listen to me. We are taking you upstairs. You keep your eyes open if you can. If you feel sleepy, you tell me. Carla grabbed weakly at Mara's sleeve. My son, he is 16. He is at home. Nobody called him. Jenna's face changed. I will have someone call. Carla's grip tightened. Tell him I am sorry. Mara lowered her voice. You can tell him yourself later. Right now, you stay with me. The paramedic was still staring. Jenna noticed again. You know her? He blinked. No, but his answer came too fast. Mara looked up, ready to move. Shaw nodded. Ready. They pushed the stretcher out of Trauma Bay 2. The hallway was worse now. Bay 1 was a storm behind glass. Rourke's voice cut through it hard and fast. Bell called for suction. Someone shouted for more blood. A monitor gave 1 long, angry tone before breaking back into rhythm. Mara passed the door without slowing. She took in the room with 1 glance. Too many bodies near the bed. Left side blocked. blood on the floor near the wheels. Rourke had control, but barely. The patient there was closer to death than Carla. That mattered. But so did the woman under Mara's hand. Triage was not choosing who mattered. It was choosing where your hands could change the outcome. At the trauma elevator, the doors took too long. Jenna stabbed the button again. Come on. Mara looked down the hall. Stairs. Not with this leg. The elevator opened. They moved in. Carla moaned as the stretcher jolted. Shaw adjusted the line. Pressure is 78 systolic. Jenna's eyes snapped to Mara. Mara was already reaching for the pressure dressing. She is still bleeding into the thigh. The elevator climbed. Too slowly. Everything in hospitals moved too slowly when blood was leaving the body. Mara placed her hand above the injury and applied deep pressure with the heel of her palm. Carla screamed. I know, Mara said close to her ear. I know. Breathe through it. I need you angry, not quiet. Carla sobbed. I am angry. Good. The elevator doors opened. OR3 was still being turned over. The cleaning team moved with frantic speed. Blue drapes came off. New packs opened. The old smell of cautery lingered under disinfectant. Someone dragged a mop across the floor and nearly collided with Jenna. Out, Jenna said. We need the room. The technician looked at the stretcher and moved faster. Rourke came down the hall at a hard walk, gloves, bloody mask hanging at his throat. What is this? Jenna stepped toward him. Carla Vance. Deteriorating. Mara is taking her to OR3. Rourke's eyes cut to Mara. I gave you assessment only. Mara did not raise her voice. She has vascular compromise and internal bleeding. Ortho is not here. Then they can catch up. You do not make that call in my hospital. Mara's hand was still pressing into Carla's thigh. Blood seeped between her gloved fingers. Carla's eyes fluttered. Mara looked at Rourke. If we wait for permission to match the bleeding, she loses the leg first, then pressure, then the rest of her. Rourke's jaw clenched. The hallway noise pressed around them. Monitors, wheels, phones. Someone crying near the family room. Somewhere, Bell called Rourke's name from Bay 1. Rourke looked at Carla's foot, then at the blood, then at Mara's face. He hated that she was right. Or 3, he said, I observe. Mara nodded once. Good. She turned away before he could decide whether the word sounded like agreement or command. Inside OR3, the room was not perfect. It was enough. Mara saw what was missing and gave orders before anyone asked. Warm fluids. 2 units in the room. Vascular tray open. External fix set ready for ortho. Suction, both sides. Jenna, I need blood bank on a live line, not a message. Jenna moved. Shaw took position at the head. Carla. I am going to help you sleep now, he said. You're in the OR. You are not alone. Carla's eyes found Mara one more time. My son. Mara held her gaze. Jenna is calling. Jenna, already on the phone, lifted one hand. I am calling. Carla's eyelids lowered as Shaw induced anesthesia. The room tightened around the table. Rourke stood near the door, arms folded, watching every motion. Mara scrubbed fast, but not carelessly. Water over hands, nails, wrists, forearms. A ritual compressed by urgency without losing meaning. The paramedic who had brought Carla stood outside the glass, breathing hard helmet still clipped to his belt. His name badge read Evan Rusk. He stared at Mara's hands as she entered the field. His face slowly changed. Not recognition of a person, recognition of a memory. A room far away, a soldier on a table, a voice that did not shake. He whispered to no one, no way. Inside, Mara extended her hand. Scalpel. This time, the word did not begin a routine case. It opened the night. The blade touched skin, and every sound in OR3 sharpened. The hiss of oxygen, the low suction pull, the soft click of instruments being shifted into reach. The monitor counting Carla Vance's heartbeats too fast. Mara. Keene worked without hurry, but nothing about her was slow. She opened the injured thigh, first moving through swollen tissue with the care of someone walking across unstable ground. Blood welled up dark and thick, not spraying, not dramatic, but steady enough to tell the truth. Carla was losing more than the room had understood. Dr. Caleb Shaw watched the blood pressure slide. 74 systolic. First unit, Mara said. The circulating nurse reached for the blood. Jenna Pike had the blood bank on the phone, one finger pressed against her other ear to hear over the room. Yes now. 2 in the room, 4 staged. Do not send them through transport. Send a runner. Dr. Garrett Rourke stood near the wall, sterile gown half-tied, eyes fixed on the field. He had come in to supervise, to contain, to catch the agency surgeon if she overstepped. Instead, he found himself watching her hands. Mara did not chase the blood. That was the first thing he noticed. Less experienced surgeons saw red and followed it. They dug into the wound with urgency, dressed as action. Mara widened the field, cleared the view, found the plane, and waited half a breath before moving deeper. It was not hesitation. It was calculation. Clamp. The scrub tech placed it into her hand. Mara guided the tip under a torn edge of tissue, lifted slightly, and the bleeding pattern changed. Rourke's eyes narrowed. She had found the source faster than the image suggested she should have. Another clamp. It landed in her palm. She placed it without looking away from the wound. The bleeding slowed. Shaw glanced at the monitor. Pressure is holding at 76. Not enough, Mara said. Warm her. Calcium ready. Second line wide open. The nurse moved. The young resident across from Mara swallowed hard. His gloves were already slick. His eyes kept jumping from the field to Mara's face, searching for permission to be afraid. Mara saw it without looking at him. Tell me what you see. The resident blinked. Doctor, what do you see? He looked down. Open femur fracture. Soft tissue damage. Active bleed controlled proximally. Possible vascular injury. Not possible. He looked again. Mara shifted the tissue gently with the tip of the instrument. His face changed. Confirmed vascular injury. Good, now breathe. The resident inhaled. His shoulders dropped a fraction. Rourke heard the exchange and felt an unwanted sting of recognition. Teaching in the middle of blood was not rare. Teaching calmly in the middle of blood was. The orthopedic attending arrived at the door with 2 residents behind him, still pulling on gowns. I heard open femur and tibia, he said. What do you need? Mara did not look up. 4 minutes. The attending frowned. For what? To keep your reduction from tearing the repair I'm about to make. The room became very still. Rourke shifted. Mara. It was the first time he had used her first name, and he seemed to realize it too late. Mara continued. 4 minutes, she said again. The orthopedic attending looked at the field. Whatever argument he had brought with him died in his throat. He stepped back. 4 minutes. Mara exposed the damaged vessel. The tear was small enough to miss and large enough to kill tissue by morning. She controlled the ends, irrigated, trimmed only what could not be saved. Then began the repair with needle movements so fine they seemed out of place in a room full of trauma. Shaw watched through the corner of his eye. He had seen vascular surgeons who moved beautifully. He had also seen trauma surgeons improvise when no vascular specialist was available. This was neither. This was a language Mara had spoken before. Often. Rourke moved closer despite himself. Where did you learn that technique? Mara tied a knot. On people who needed it. That is not an answer. It is the only one I have time for. No arrogance. No heat. Just the truth of the room. The monitor tone steadied by a few degrees. Shaw looked up. Pressure 86. Keep going. The second unit was hung. Jenna moved around the edges of the room like a second circulatory system, anticipating what the team needed before they asked. She had worked many trauma cases, but this felt different. Not easy. Never easy, but aligned. The room was no longer reacting. It was responding. Mara finished the repair and checked flow. Release. The clamp came off. Everyone watched the foot. For one terrible second, nothing changed. Then, color returned and a faint, stubborn blush across Carla's toes. The young resident whispered pulse. Mara's eyes did not leave the leg. Doppler. The nurse placed it. A soft rushing sound filled the room. Not loud. Not dramatic. Enough to make the orthopedic attending close his eyes for half a second. Rourke heard it and felt something in his chest loosen before he could stop it. Mara turned to ortho. Now. They stepped in. The attending took the leg carefully. Mara watched his hands. Do not pull. I know. Slide. He glanced at her annoyed, then did exactly that. Bone alignment came slowly. External fixation followed. Pins placed. Angles checked. The room's rhythm changed again, but Mara did not surrender awareness. She protected the repaired vessel while the orthopedists stabilized the skeleton around it. When the last pin was set, Mara checked perfusion again. Still there. Good. She closed the soft tissue with efficient precision, leaving what needed to be revisited, protecting what needed protection, documenting out loud only what the team required. Shaw looked at the clock. He did not speak. Rourke did. How long? Shaw's eyes stayed on the monitor. 52 minutes from incision. The orthopedic attending looked at him. That is wrong. Shaw gave a tired half-smile. I did not build the clock. Mara removed her gloves. Recovery. Hourly pulse checks. Ortho re-evaluation in 2 hours. Watch compartment pressures. Jenna, call her son after she is settled. Not before. He needs facts, not hallway panic. Jenna nodded. I have his number. Mara stepped away from the table. Rourke moved into her path before she could leave. You performed a vascular repair. Yes. You are credentialed for general and trauma coverage. She needed a vascular repair. That is not my point. Mara looked at him. It was hers. The stretcher rolled past them, carrying Carla Vance toward recovery with blood moving into a foot that had almost been lost. Rourke watched it go. For once, he did not have a clean reply. Outside the OR glass, Evan Rusk, the EMT, stood still as the gurney passed. His face was pale. His eyes followed Mara's hands as she stripped off her gown. Jenna noticed him again. Evan. He looked at her like he had heard his name from underwater. I have seen hands move like that, he said. Where? He swallowed. I do not know. Maybe I'm wrong. But his face said he was not. Before Jenna could ask more, the trauma pager screamed again. Bay 1 was calling for help. Rourke turned sharply and walked into the hall. What now? A nurse came fast from the elevator mask hanging beneath her chin. Male patient from the crash. Miguel Arroyo. Chest trauma. They stabilized him in Bay 1, but he is crashing again. Bell is tied up with the abdominal case. Sutton is in imaging with the rollover driver. Rourke's eyes moved once toward Mara, then away. No. Mara was already washing her hands. The nurse looked between them. Doctor, he is hypotensive. They think he is bleeding into the chest. Rourke's jaw tightened. I said no. Shaw stepped out of OR3, pulling off one pair of gloves. Garrett. Rourke rounded on him. Do not. Shaw held his gaze. I can cover anesthesia. Rourke looked down the hall toward Bay 1, where the doors were open and voices were stacking over one another. Mara shut off the water. Her voice was quiet. Who is available? Rourke said nothing. That was the answer. Mara dried her hands. The patient is not waiting because you dislike the option. Rourke stepped closer. You are not the option until I make you one. Mara held his gaze calm as stone. Then make me one. For a moment, the hallway seemed too narrow for both of them. Jenna watched Rourke's face. She knew his pride. She knew his fear. She also knew the math of the night. There was a man bleeding somewhere below them, and the hospital was out of elegant choices. Rourke looked toward Bay 1 again. Or 1, he said, now. Mara moved before the final word left his mouth. Or 1 was larger, colder, brighter. The kind of room meant for big damage and bigger consequences. Miguel Arroyo arrived with a chest tube, already placed his skin gray, his lips nearly blue under the oxygen mask. Shaw took the head of the table. Pressure is 68, heart rate 140. We are losing the window. Mara looked at the imaging on the monitor. A jagged fragment from the crash had torn deeper than the first assessment showed, bleeding into the chest. Compression. A patient being pushed toward the edge by inches. Prep wide, Mara said. Blood in, suction ready, thoracic tray open. A resident hesitated. Dr. Rourke usually wants to be called before opening chest. Mara looked at him. "He is standing behind you." The resident turned. Rourke stood at the door. His face was unreadable. "Do what she says," he said. That sentence changed the room. Not fully. Not forever. Enough. Mara scrubbed and entered. The incision was clean and fast. The chest opened. Blood came up immediately, dark and hot, filling the suction canister with a sound that made the resident's face tighten. Shaw's voice stayed controlled. Pressure dropping, 58. Mara extended her hand. Rib spreader. The instrument came. The field opened. For half a second, even Rourke forgot to breathe. The injury was bad. Not impossible. Bad. Mara's eyes moved once across the field, and something in her expression shifted. The stillness deepened. The room around her seemed to fall away. Shaw saw it. So did Rourke. Mara's hand moved. Clamp. The scrub tech placed it. Longer. The tech switched before being told twice. Mara controlled the first source, then the second. A smaller bleed appeared where the tissue had torn under pressure. She caught it almost before it announced itself. Rourke stepped closer. "That approach," he said quietly. Mara did not answer. Shaw looked at him. "You have seen it." Rourke's eyes stayed on the field. Once, in a combat surgical briefing. Mara kept working. Miguel's heart rate began to fall back from the cliff. Shaw watched the numbers. Pressure is coming up. 72, 76. "Do not celebrate," Mara said. "No one is celebrating." Good. She repaired the damaged tissue with brutal gentleness, a strange combination that made sense only while watching it happen. She was fast when speed mattered, and slow where one careless movement could steal everything back. The resident across from her whispered, "How do you know where to go?" Mara's eyes stayed down. "You listened to the injury." The resident did not understand. Rourke did. That bothered him more. 39 minutes after incision, Miguel Arroyo's pressure held. The bleeding stopped. The field stayed clean. The room, which had entered in panic, settled into disbelief. Mara closed. "ICU. Repeat chest imaging. Keep him warm. Blood gas in 30 minutes. Shaw looked at the clock again, and then at Rourke. No one said impossible this time. They had already used that word once tonight, and it had not survived contact with Mara Keene. Rourke followed her into the scrub area. The sound of running water filled the silence between them. He stood behind her, watching blood dilute into pink streams and vanish. "Keene." "Yes. Where did you train?" She scrubbed under one nail. "A few places." "Stop saying that." She rinsed. "Stop asking like you want a simple answer." Rourke's voice dropped. That chest repair was not standard civilian technique. Mara turned off the water. "It was standard for the patient in front of me." He stepped closer. "Were you military?" Her hand paused on the towel. Not long. Long enough. Then the pager went off again. Jenna appeared at the corner. Her face changed in a way that made both of them turn. "Pediatric trauma," she said. Rourke's expression hardened. "Where is Dr. Hanley?" "Still with Bell in OR2. They cannot break away." "How old?" Jenna swallowed. 7. Mara was already moving. Rourke stepped into her path. "No." Mara looked at him. The word hung between them like a locked door. "No," he repeated. "Pediatric trauma is different." "Yes," Mara said. "It is. You do not walk into a child's abdomen because you had 2 good saves." Mara's face did not change, but her voice did. It became quieter. "He cannot wait for your comfort." Jenna's eyes flicked to Rourke. "Garrett, his pressure is falling." Rourke looked toward the pediatric OR doors. The old instinct rose in him. Control the risk. Protect the institution. Protect the patient from the unknown. Then he saw the blood still caught beneath Mara's fingernails. He heard the monitor tones from the 2 patients she had just pulled back. He hated the decision because it did not feel like command. It felt like surrender. "Or 2, he said. "I am in the gallery." Mara did not thank him. She went. Noah Ellery looked impossibly small on the operating table. 7 years old. 48 pounds. Hair damp with sweat. Skin pale under the lights. A dinosaur sticker was stuck crookedly to the blanket near his shoulder, bright green and absurd in the middle of tubes and tape. His mother's voice carried from the hall until someone closed the door. "Please, please, he is all I have. Please." The sound hit the room harder than any alarm. The pediatric resident was young freckles visible above her mask eyes too wide. Blunt abdominal trauma. Possible splenic laceration. Free fluid. Hemoglobin dropping. He was responsive downstairs but getting lethargic. We gave fluids, but pressure is still soft. He weighs 22 kilos. No known allergies. No history. She said it too fast. Mara stood beside the table. Again. The resident blinked. What? Again. Slower. Make the room understand him. The resident swallowed, then began again. Mechanism. Vitals. Labs. Imaging. Response to fluids. This time the words became useful. Mara listened to every one. Then she looked around the room. Noah is cold, small, and bleeding. We do not punish him for being any of those things. Warm everything. Small movements. Clear speech. No extra hands near the field. Shaw entered tying his mask, his fatigue visible now. I have him. Mara looked at him. You good? He met her eyes. Yes. It was the first time she had asked anyone that all night. Rourke watched from behind the glass above OR2. Beside him, Paige Sutton stood with her arms folded. Bell arrived moments later, still marked with dried sweat at his temples from his own case. Neither of them spoke. Below, Mara placed her hands near the child's abdomen. Everything about her changed. Not her calm. That remained. But the shape of her movements softened. Her hands became lighter. The brutal clarity she had brought to Miguel Arroyo's chest narrowed into something more delicate, almost protective. The incision was smaller than Bell expected. The exposure was cleaner than Paige expected. Rourke expected himself to find something wrong. He did not. The bleeding was there, tucked against the spleen, active enough to kill him, controlled enough to save if no one got greedy. Mara did not. She packed carefully, waited, cleared, found, controlled. The pediatric resident across from her was breathing too fast. Mara spoke without looking up. What is your name? Emily. Emily, put your hand here. The resident did. Less pressure. Emily adjusted. Feel the difference. A pause. Yes, that difference is tissue you do not have to injure. Emily's eyes filled, but her hand steadied. Shaw looked at the monitor. Pressure is improving. Mara tied. Keep warming. Already doing it. The room stayed quiet enough to hear the ventilator breathe for Noah. In the gallery, Bell shifted his weight. Peds is not my area, he murmured. Paige looked at him. No one asked. He went silent. Rourke's hands rested on the rail. He watched Mara work and felt the night changing around him in ways he could not name. He had seen brilliant surgeons. He had hired some. He had fired a few. Brilliance could be loud, cruel, impatient, dazzling. Mara's brilliance did not shine. It absorbed panic. 43 minutes later, Noah Ellery's bleeding was controlled. His pressure was stable. His temperature was climbing. Mara closed with careful small sutures. Recovery. ICU watch. Repeat labs. Tell his mother he is alive before you tell her anything else. The circulating nurse nodded, and her eyes shone above her mask. As Noah rolled out, Mara stood still for half a second longer than she had after the adult cases. Not long enough for anyone else to call it emotion. Long enough for Shaw to see the cost. Rourke came down from the gallery and met her in the corridor. This time he did not block her path. He stood beside it. Good work, he said. Mara looked at him. Your team kept him alive. It was not false modesty. She said it like a correction. Jenna arrived with another chart before Rourke could answer. I am sorry. Rourke closed his eyes for 1 second. What? Diane Mercer. 62. Complicated gallbladder. Severe adhesion suspected. She was scheduled for later, but she has febrile white count climbing pain worse, and now pressure is soft. Bell rubbed both hands over his face. I can take a gallbladder. Jenna looked at him. You just came out of a contaminated abdominal trauma and have not written orders. I said I can take it. Mara reached for the chart. Rourke watched her. You have done 3 major cases and 1 routine case in less than 3 hours. Mara scanned the page. Diane Mercer does not care. Rourke stepped closer. Do you? Mara looked up. The question was not hostile. That made it harder. I care, she said. That is why I am still standing. Bell let out a breath. This is insane. Mara turned to him. Then sit down. No one laughed. Bell's face flushed. Rourke looked at Jenna. Or 3. Clean and ready. Rourke looked back at Mara. Proceed. Diane Mercer's abdomen was a map redrawn by old Payne. The scan had warned them about adhesions. The scan had been polite. Inside, scar tissue crossed the field in pale bands, binding structures that should have moved freely, pulling anatomy out of its expected places. The gallbladder was inflamed, buried stubborn. A routine surgeon could get lost here. A careless one could create a disaster and call it unavoidable. Mara adjusted the camera angle. Light left. The image shifted. Hold steady. The resident held. This resident was older than Emily, more confident, and more frightened of looking frightened. Mara noticed. If you do not know what you are seeing, say so. The resident hesitated. I do not know what I am seeing. Good, now we can work. In the gallery, Paige Sutton watched with narrowed eyes. Adhesions were where ego went to die. You could not bully scar tissue. You could not charm it. You could not rush history out of a body. Mara did none of those things. She waited for tension to reveal the safe plane. She used tiny movements, each one almost too small to matter, until the field began to open. Scar tissue yielded not because she forced it, but because she understood where it was willing to let go. Shaw stood at the head of the table, shoulders heavy now. You want music? He asked. No. Worth asking. Mara's eyes stayed on the monitor. You ask when things are calm. I ask when they are too calm. That almost brought the corner of her mouth upward. Almost. Then the bleed came. Small, sudden, bright. The resident stiffened. Mara's voice stayed level. Suction. The field cleared. Do not move the camera. The resident froze. Mara placed the instrument, lifted, sealed, watched. The bleeding stopped. No raised voice. No panic. No second injury created by the first. Paige whispered from the gallery almost unwillingly. That was clean. Bell did not answer. Rourke heard her anyway. Below, Mara identified the duct with care bordering on reverence. Confirm anatomy, she said. The resident leaned in. Cystic duct. Again. He looked longer. Cystic duct confirmed. Why? He swallowed. Because the common duct is medial and deeper. The angle is wrong for common. The plane is now visible. Good. Rourke watched the teaching and felt another quiet correction land inside him. Mara was not only saving the patient. She was upgrading the room while she did it. That was rarer. 55 minutes after incision, Diane Mercer was closed. Stable. Clean. Alive. Mara stepped back. Recovery. Antibiotics as ordered. Watch for bile leak. Labs in the morning. The scrub tech stared at the field like he needed another minute to accept it. Mara looked at him. You good? He blinked. Yes, doctor. Then move. He moved. In the corridor, the hospital had begun to gather around the rumor of her. Not openly. Hospitals did not like to admit they had rumors, but they fed them constantly. A nurse at the station stopped typing when Mara walked past. A resident turned too quickly and pretended to look at a chart. 2 techs lowered their voices. Bell stood near the wall, no longer smiling. Paige watched Mara with an expression that had lost its edge and gained something more uncomfortable. Respect, maybe, or the beginning of humility. Mara did not look at any of them. She went to the sink and washed her hands. Again, water over skin, blood thinning, pink, clear. Jenna approached with her tablet clutched tighter than before. Mara. Rourke looked up at the use of her first name. Mara shut off the water. What is it? Russell Tate. 49. Suspected appendicitis. CT looked strange, but they thought scar tissue from prior surgery. He was being held for morning. Now he is deteriorating. Pain escalating. Pressure dropping. White count high. Lactate rising. Rourke rubbed the bridge of his nose. Who admitted him? Sutton consulted. Page stepped forward. I saw him before the crash wave. He was stable then. Mara took the tablet. Her eyes moved quickly. Where is he? Trauma 5. Rourke reached for the tablet. Mara handed it to him. He read the numbers and felt the answer before he said it. Or Dr. Helena. Brooks arrived at the end of the corridor in a dark coat over hospital clothes hair, pinned tight eyes awake in a way that made everyone straighten. The chief medical officer did not come in after midnight unless the problem had teeth. Garrett, she said. Rourke turned. Helena. Her eyes moved from him to Mara, then to the tablet in his hand. I have been getting calls about an agency surgeon performing high-acuity cases. Mara said nothing. Brooks stepped closer. I need privileges verified before she takes another complex case. Jenna's jaw tightened. HR already cleared her. Brooks looked at her. HR clears entry. I clear exposure. Rourke looked through the glass toward Trauma 5, where Russell Tate's bed was being wheeled toward the elevator. Not now. Brooks's eyes sharpened. Especially now. Mara handed her towel away and reached for a clean cap. Russell's stretcher rolled past the corridor intersection. He was awake, clammy jaw clenched against pain. His eyes found the cluster of doctors and administrators and understood enough to be afraid. Please, he said. Somebody tell me if I am dying. The question cut through the hallway. Mara moved to his side. Not fast. Not dramatic. Present. Russell, look at me. His eyes locked onto hers. You are very sick. We are taking you to surgery now. Am I dying? Not while we are moving. His lips trembled. I have a daughter. What is her name? Lily. Then you breathe for Lily until Dr. Shaw takes over. In through your nose if you can. Good. Again. Russell followed her voice. Brooks watched. Rourke watched Brooks watching. Helena, he said quietly, we verify while she operates. Brooks did not look away from Mara. If this goes wrong, the board will ask why I allowed an unverified temp to continue. Rourke's voice lowered. If he dies while we argue, his daughter will not ask the board anything. She will ask us. Brooks's face tightened. For 1 second, the hospital's two truths stood facing each other. Risk to the institution. Risk to the man on the stretcher. Mara looked at Brooks. You can call whoever you need. I cannot operate from the hallway. Brooks' eyes held hers. You will answer questions when this is done. Yes, fully. Mara's voice did not change. When this is done. Brooks stepped aside. Not approval. Not trust. Permission under protest. It was enough. Or one filled again. By then, the observation gallery had gathered faces. Rourke at the rail. Brooks just behind him. Bell and Page near the back. Jenna below moving between phone calls and the circulating desk. Evan Rusk stood farther down the hall, where he was not supposed to be, helmet in one hand, eyes fixed through the glass whenever the door opened. Inside, Russell Tate was induced under Shaw's steady voice. You are going to sleep now, Russell. Keep breathing, that is it. Mara stood scrubbed at the field. Her face looked no different than it had for Henry Dale's gallbladder. That was the part that unsettled Rourke most. The scale changed. The stakes changed. Mara did not. Scalpel. The case began like an appendectomy. Familiar entry. Expected anatomy. Then the picture shifted. Scar tissue pulled the bowel into an unnatural angle. The appendix was displaced and inflamed, but it was not the whole problem. Fluid where it should not be. Tissue angry and fragile. A hidden source of bleeding tucked behind distorted anatomy. Mara paused. Just one beat. In the gallery, Bell leaned forward. There, Page whispered. Rourke saw it too. One wrong cut would open the wrong plane. One aggressive pull would tear what little stability remained. Below, Shaw's voice tightened. Pressure is dropping. Mara's eyes stayed on the field. 2 units. Warm, suction ready. Gentle traction. No one pulls unless I say pull. The resident assisting her nodded too quickly. Mara glanced at his hands. Slow is smooth. He inhaled. Smooth is fast, she said. The words left her mouth with the rhythm of something old, something drilled into muscle. In the gallery, Brooks looked at Rourke. He did not look back. Mara entered the distorted plane with patient precision. Blood appeared suddenly blooming across the field. The resident froze. Mara did not. Suction. The field cleared. Angle left, no smaller. Good. She placed the clamp exactly where the bleeding narrowed, not where it was loudest. Rourke's grip tightened on the rail. He saw the decision. He saw why it worked. He also saw that he might not have made it in time. That was the thought that opened something cold beneath his ribs. Shaw watched the pressure. Still low. Another unit. Running. Mara changed the plan without announcing it as failure. She widened exposure, protected the bowel, isolated the source, and repaired what the scan had not respected enough to name. The room followed her in silence. No one spoke unless needed. No one filled the air to prove they were useful. The bleeding stopped. Not gradually. Stopped. Shaw waited, eyes on the monitor, pressure coming up. 78-84. Mara did not answer. She checked the field again, then again. Only when the body stayed quiet did she proceed. In the gallery, Paige Sutton removed her mask and pressed it between both hands. Belle's face had gone pale. He was good enough to understand exactly how good she was. That was the punishment. Mara completed the appendectomy, irrigated, inspected, and began closing with the same clean certainty she had carried all night. The final sutures landed in a neat line. Not pretty for the sake of being pretty. Functional. Respectful. Done right because done poorly would still count as harm. Shaw looked at the clock. His expression tightened. Rourke saw it. How long, Brooks asked. Shaw did not answer through the glass. He only looked down at the patient, then at Mara. Mara stepped back. Transport. PACU, first ICU if pressure changes. Labs in 30. Tell his daughter he is alive when family arrives. The word alive moved through the room like air returning. The stretcher rolled out. Mara removed her gloves. Snap. Snap. She turned toward the sink. Above her, Rourke leaned toward the glass. The question rose before pride could bury it. Not loud. Not meant for anyone. Who are you? Mara did not look up. She washed her hands. Water ran red, then pink, then clear. Outside OR1, the corridor waited with too many faces. Brooks stood first. Rourke followed. Belle and Paige came down behind them, quieter now. Jenna ended her call and turned toward Mara. Evan Rusk stood near the wall, staring as if memory had finally caught up with him. Mara stepped into the hull cap in one hand. For the first time all night she looked tired. Not weak. Tired in the way mountains looked tired after weather. Brooks approached. Dr. Keene. Mara met her eyes. Yes, that was your 5th operative case since arrival. Mara said nothing. Your submitted file does not explain what I just watched. Rourke looked at Mara, but his voice stayed low. She saved them. Brooks did not look away. I know. That made the silence heavier. Because she was not denying the miracle. She was naming the danger around it. Brooks continued. I need to know exactly who is operating in my hospital. Mara's expression did not change, but the air around her seemed to cool. Evan Rusk took one step forward. Jenna saw him. Evan, not now. He shook his head slowly. I know where I saw her. Mara's eyes shifted to him. For the first time all night something in her calm moved. Not fear. Recognition of a door opening. Evan's voice dropped. Landstuhl. After Kandahar. The hallway went still. Mara held his gaze. He swallowed. They called you Ghost Hand. The name did not echo through the corridor. It did something worse. It settled. Every person standing outside OR1 seemed to hear it differently. Jenna Pike heard a warning. Garrett Rourke heard an explanation he was not ready to accept. Helena Brooks heard a liability with a pulse. Travis Bell heard the sound of his own arrogance folding in on itself. Paige Sutton heard the first honest thing anyone had said all night. Mara Keene stood beneath the fluorescent lights with her surgical cap in one hand and blood still dark beneath the edges of her nails. She looked at Evan Rusk for a long moment. The EMT had gone pale. His helmet hung from one hand. His other hand was half lifted as if he wanted to point at her but knew better than to treat her like an exhibit. Mara's voice stayed quiet. You have me confused with someone else. Evan shook his head slowly. No, ma'am. The ma'am landed like a military reflex too old to fake. Mara's eyes narrowed by a fraction. Evan swallowed. I was with a transfer team out of Germany, Landstuhl, 4 years ago. 3 criticals came in from Kandahar. One of them had no business still being alive. The hallway noise softened around him. Nurses slowed without meaning to. A tech stopped near the medication cart. 2 residents at the desk pretended to read a chart, eyes fixed over the top of it. Evan kept looking at Mara. You walked into that room and every person inside moved like they had been waiting for you. Nobody introduced you. Nobody asked questions. A colonel just stepped back and said, "She has it." Mara's face gave away nothing, but Jenna saw her hand tighten slightly around the cap. Evan took a breath. I remember your hands. I remember how quiet you were. They called you Ghost Hand because you could reach into a body that was already gone and bring something back. The silence after that was too full. Dr. Helena Brooks stepped forward. She was still in her dark coat. Her face controlled her eyes sharp in a way that did not waste emotion. Dr. Keene, is any of that true? Mara looked at Brooks. People under stress remember things incorrectly. Evan's voice broke through before Brooks could respond. I remember him waking up. Mara's gaze flicked back to him. Evan's throat worked. The soldier. The one they said would not make the flight. He woke up 2 days later. Asked for his brother. I remember because everyone in that ward cried like they were trying not to. For the first time, Mara looked away. Not down. Not in shame. She looked past them, toward a wall that was not the wall anymore. Her eyes focused on some distance the hospital could not contain. Rourke saw it. A door closing inside her. Brooks opened the folder in her hand. Your file lists residency at Hawthorne University Medical Center Fellowship at St. Anselm Trauma Institute and temporary privileges through Western Medical Staffing. There is no military service listed. Mara's expression returned to stillness. No. Brooks waited. No, there is no military service listed, Mara said. Why? Because it was not required for the assignment. Brooks's jaw tightened. That is not how credentialing works. Mara's eyes came back to her. It is how privacy works. Rourke stepped in, voice low. Mara. She turned to him. The use of her first name no longer sounded accidental. Rourke looked different now. The authority was still there, but the certainty behind it had cracked. He had watched her save 5 people. He had watched her do work that should have belonged to an entire roster of specialists. He needed the truth not because he wanted control now, but because the unknown had become larger than his pride. Were you military? Mara did not answer right away. Down the hall, a monitor alarm chimed twice and stopped. An elevator opened. Someone laughed too loudly near the nurse's station and then went quiet, sensing the air. Mara set the cap on a supply cart. Yes, the word was small. It changed everything. Brooks did not blink. In what capacity? Mara looked at the floor for half a second, then back up. I was attached to the 47th Forward Surgical Response Unit. Rourke's face tightened. Where? Kandahar Province. Bell's lips parted, but no sound came out. Paige Sutton stared at Mara with the expression of someone realizing she had mistaken silence for emptiness. Brooks' voice stayed formal. Dates. 4 years. As a surgeon. As the surgeon available. That answer moved through the hallway like cold air. Brooks looked down at the file. Your file does not mention combat surgical service deployment history field hospital work or prior Department of Defense attachment. No. Did you intentionally omit it? Yes. There it was. No evasion. No apology. Rourke exhaled through his nose. Brooks looked up. You understand how serious that is? Mara's eyes held hers. I understand serious. Brooks stepped closer. This hospital granted privileges based on the file submitted to us. You granted privileges based on license board status, malpractice record references, and procedure logs. And incomplete history. Not incomplete for your legal requirement. Brooks's voice sharpened. That is not your determination to make. Mara did not raise her voice. Then make it now. The line hit harder because it carried no challenge. It was simply an opening placed on the table. Brooks studied her. How many procedures under combat conditions? Mara's face changed almost imperceptibly. The question did not offend her. It cost her. Rourke saw the difference. "Mara," Jenna said softly. Mara glanced at her. Jenna did not know why she had spoken. Maybe to remind Mara that someone in the hallway was not trying to corner her. Maybe to remind everyone else that this woman had been operating for hours and had not once asked for anything for herself. Mara looked back at Brooks. 812. No one moved. Even Rourke, who had expected a large number, felt the ground shift beneath it. Brooks's pen stopped above the folder. 812 surgeries. Documented operative cases. There were procedures that would not make a civilian log. Shaw, still standing near the OR doors, lowered his eyes. He understood what that meant. Procedures performed because transport was impossible. Procedures done under power loss, under fire, under conditions where sterile was a prayer as much as a protocol. Rourke's voice came out rough. How many were trauma? Mara looked at him. Most. Bell whispered almost to himself. Jesus. Mara's eyes moved to him and he looked away. Brooks recovered first. And the name Ghost Hand. Mara's mouth tightened. A nickname. Earned how? By people who needed something to call me. Evan spoke again softer now. They called you that before you entered a room. Like a signal. Like if you were coming, somebody still had a chance. Mara closed her eyes for one brief second. When she opened them, they were clear again. Nicknames are what frightened people build when facts are not enough. Rourke took a step closer. How many non-survivable patients? Mara's gaze snapped to him. The temperature in the hallway seemed to drop. You do not call them that. Rourke went still. Mara's voice remained low, but something edged beneath it now. Not anger exactly. Memory with its gloves off. You can call a wound non-survivable. You can call a situation non-survivable. You do not call a person that while their heart is still making an argument. Rourke absorbed the correction. He nodded once. How many patients triaged as expectant were later recorded as survivors? The clinical language hurt less. Not much. Mara looked past him again. 141. Jenna felt her throat close. Page's eyes dropped to the floor. Bell looked like he wanted to vanish into the wall. Brooks wrote the number down, but slowly, as if the pen had become heavy. 141, she repeated. Mara's voice flattened. Recorded. What does that mean? It means some names do not make it into the right column. The hallway held that too. Rourke looked at her hands again. He remembered the first moment he had seen her faded Scrubs' shoes battered bag. He had seen a temporary surgeon. He had seen a risk. He had not seen a woman carrying 800 rooms behind her. Brooks closed the folder. Why are you working agency shifts under a limited file? Mara looked at her. Because hospitals need coverage. That is not an answer. It is the answer that matters tonight. It is not the answer that explains you. Mara's eyes hardened slightly. I did not come here to be explained. Brooks' voice cooled. You are operating inside my hospital. Explanation is no longer optional. Jenna glanced at Rourke. He did not interrupt. Mara looked down the corridor toward recovery where 5 patients now occupied beds they might never have reached. Her voice when it came was quieter. I came home and everyone wanted a version of me they could understand. No one spoke. Mara continued. The military wanted a story about resilience. Hospitals wanted a brand. Conferences wanted a speaker. Reporters wanted a woman who could say something clean about war and healing. Administrators wanted the prestige without the noise that came with it. She looked at Brooks. And patients still needed surgery. Shaw watched her from near the wall. He had seen surgeons boast, deflect, flatter, perform. This was none of that. Mara spoke like each sentence had been pulled from a place she preferred to keep sealed. Rourke's voice softened despite himself. So you disappeared into temp work. Mara's eyes moved to him. I worked. That is not the same thing. It is to the patient on the table. Brooks folded her arms. You cannot build a career by hiding from every system that asks questions. Mara's expression stayed calm. I am not hiding from questions. I am refusing to be turned into an answer people like better than the work. Bell finally spoke. His voice was subdued, stripped of the smooth arrogance from before. Why not tell us when you arrive? Mara looked at him. You had already decided who I was. Belle's face colored. She did not say it cruelly. That made it worse. Paige stepped forward, voice quieter. We did. Mara looked at her. Paige held the look. I did. For a moment, no one knew what to do with the honesty. Jenna's pager vibrated. She checked it, then glanced toward Rourke. All 5 post-ops are stable. Carla has a pulse in the foot. Noah's temperature is coming up. Russell's pressure is holding. Mara's shoulders lowered by the smallest degree. Rourke noticed. So did Brooks. That was the first visible relief Mara had allowed herself all night. Brooks softened her tone, but not her posture. Dr. Keene, you will provide full documentation. Yes. Military service records where releasable. Procedure logs. Prior privileges. Any restrictions. Any evaluations related to fitness for duty. Mara's eyes sharpened. Fitness for duty. Brooks did not flinch. You have performed 5 operations in extreme conditions after arriving from another assignment. You have omitted major professional history. I would ask the same of anyone. No, Mara said. The word was not loud. Brooks's chin lifted. No, you would not ask the same of anyone. You would ask because I make you uneasy. Brooks held her gaze. Yes. The honesty surprised the hallway. Brooks continued. You make me uneasy because you are extraordinary, undocumented in the ways that matter to risk and clearly used to making life and death decisions faster than civilian systems can review them. Mara studied her. Brooks's voice lowered. You also saved 5 patients in a hospital that was not ready for the night it received. Both things are true. Rourke looked at Brooks. For the first time that night, he was grateful for her. Not because she was easy, because she was precise. Mara nodded once. Then verify me. We will, when the work is done. Brooks looked toward the schedule board. For the next hour, the work appears to be stable. Jenna checked her tablet again. No active surgical emergency. ER has 2 observation cases and 1 consult pending imaging. Mara picked up her cap from the cart. I have post-op orders to finish. Brooks stepped aside. Not because the conversation was over, because for once everyone agreed that the living patients had earned the next minutes. Mara walked toward the break room. The crowd parted without anyone telling it to. Evan Rusk remained by the wall. As Mara passed him, he spoke softly. Ma'am. She stopped, not fully turning. Evan's voice shook. The soldier from Landstuhl. His name was Aaron Pike. He had a little sister. He made it home. Mara's face did not move, but Jenna saw the breath she took. Slow, measured. Not enough. Mara looked at Evan. I am glad. That is all. Her eyes held his. That is everything. Evan's mouth tightened. He nodded, and his eyes shone. Mara continued down the hall. Jenna followed after a moment. Inside the break room, the fluorescent lights buzzed over a table scarred by years of coffee cups and bad news. The vending machine hummed near the corner. Someone had left half a sandwich wrapped in plastic beside a stack of outdated magazines. Mara sat with the charts. One by one she wrote. Carla Vance. Vascular repair. Pulse checks hourly. Monitor for compartment syndrome. Miguel Arroyo. Chest repair. Repeat imaging. ICU monitoring. Blood gas. Noah Ellery. Pediatric trauma. Warming protocol. Serial labs. Family update first. Diane Mercer. Adhesion case. Watch for bile leak. Continue antibiotics. Russell Tate. Complicated appendectomy. Repeat labs. Pressure monitoring. Family communication. Her handwriting was compact and exact. No flourish, no wasted line. Jenna stood by the door for a while before speaking. You could have told me. Mara did not look up. I could have. You did not trust me. Mara's pen paused. I did not know you. Jenna accepted that because it was fair. And now, Mara resumed writing. Now I know you move when patients need you to. Jenna looked away for a second. That is probably the nicest thing a surgeon has ever said to me. It was not meant to be nice. I know. That is why it worked. Mara almost smiled. Almost. Shaw entered a moment later with 2 paper cups of coffee. He set one near Mara. She looked at it. I did not ask. You looked like someone who would forget. She picked up the cup and took a sip. Her face changed slightly. Shaw nodded. Yes, it is terrible. I have had worse. I believe you now. A quiet settled between them. Jenna leaned against the counter. Shaw sat across from Mara. For a few minutes, the only sound was the scratch of Mara's pen. Then Shaw spoke. The chess technique. I saw it once in a military trauma lecture. I thought the instructor was exaggerating. Mara kept writing. Most instructors do. You did not. No, because you were there. Her pen stopped. Shaw did not push further. Mara looked at the chart in front of her. The first time I opened a chest under incoming fire, the lights went out. Jenna's posture changed. Mara's voice stayed even, but the room seemed to tighten around it. The generator cut. Dust came through the tent seams. Someone outside was screaming for more stretchers. The patient was 23, maybe 24. He kept asking if his mother had been called. We had headlamps suction that worked when it wanted to, and a field table that shook every time something landed close. Shaw did not move. Jenna barely breathed. Mara looked at her own hands. I remember thinking my fear did not matter. Not because I was brave. Because there was no place to put it. My hands were full. The vending machine hummed. Somewhere beyond the door, a phone rang and stopped. Mara picked the pen up again. After that calm became procedure. Jenna's voice was soft. Did he live? Mara wrote one more line. Yes. The answer should have brought relief. It did not, because the room could hear the other names behind it. Rourke appeared in the doorway. He had removed his bloody gown, but his sleeves were still rolled. His face looked older in the break room light. Brooks stood behind him, file still in hand. Neither entered immediately. Mara looked up. Do you need something? Rourke stepped inside. Yes. He looked at the charts, then at Mara. I need to apologize. Bell could not have stunned the room more if he had walked in singing. Mara said nothing. Rourke continued. I judged you on arrival. I limited you because I thought I was protecting patients from an unknown. Some of that was duty. Some of it was pride. Mara watched him. Rourke swallowed. I do not regret asking questions. I regret deciding the answers before you gave them. Mara leaned back slightly. That apology is for you. Rourke absorbed it. Yes, a beat. Then Mara nodded. Accepted. Not warm. Not unkind. Enough? Brooks entered after him. I spoke with Western Medical Staffing. Your license and board certification are confirmed again. Prior civilian privileges are confirmed. They are contacting federal references for what can be released. Mara nodded. Good. Brooks studied her. You made it difficult to verify the most important part of your background. Mara looked at her. The most important part of my background is whether the patient survives my decisions. No, Brooks said. That is the most important outcome. Background tells us how much danger your decisions carry before the outcome arrives. Mara did not answer immediately. Then she nodded once. Fair. Brooks seemed surprised by the concession. Rourke looked at the empty chair near the table, but did not sit. What are you going to do when the shift ends? Mara's face closed by habit. Leave documentation complete. That is not what I asked. I know. Jenna looked between them. The room held another kind of tension now, not the urgent, bloody kind from the OR. This was quieter. A question of whether a person who had trained herself to move from crisis to crisis could stand still long enough to belong anywhere. Rourke spoke carefully. We need surgeons. Mara's gaze stayed level. You need systems. We need both. Brooks looked at him sharply. Rourke did not back down. Mara is right about one thing. Last night exposed every weak seam we have. Blood response, trauma routing, OR access, supply readiness, staff training. We survived because she walked in. That is not a plan. Mara's eyes moved to him. For the first time, she seemed truly interested in something he had said. Brooke's expression remained guarded. And you propose what? Rourke looked at Mara. I propose we stop pretending coverage is the same as readiness. Jenna's voice was quiet. That would be new. Shaw took another sip of coffee and grimaced. The coffee can stay bad. Everything else should improve. No one laughed loudly, but the room loosened. Mara looked down at the charts, then at her hands. The blood was gone from her skin now, but she could still feel it. She always could after nights like this. Civilian hospitals cleaned faster than field tents. The memory did not. Brooks closed the folder again. We will meet formally after first light. Mara stood. I have one more recovery check. Rourke looked at her. You have been operating for hours. Mara picked up the top chart. And they have been recovering for less than one. No one argued. She walked past them into the corridor. The first gray edge of morning had begun to press against the windows at the far end of the hall. El Paso was still mostly dark, but the black outside had thinned. The ambulance bay lights glowed below. A cleaning worker pushed a cart past the elevators. A nurse from day shift arrived with wet hair and a fresh badge reel, stepping into a night she did not yet understand. Mara paused outside recovery. Through the glass, Carla Vance slept beneath warm blankets. Her injured leg was elevated. A nurse checked the pulse in her foot and looked up with a small nod. Alive. Down the hall, Miguel Arroyo's monitor held steady. Noah Ellery's mother sat beside his bed, both hands wrapped around his tiny fingers, crying silently without looking away from his face. Diane Mercer snored under oxygen. Russell Tate murmured a name in his sleep. Lily. Mara stood in the doorway for 1 second longer than necessary. Rourke came up beside her but did not speak at first. He watched the patients. Then he watched her watching them. Ghost hand, he said softly. Mara's eyes stayed on recovery. Do not call me that. What should I call you? She turned her head slightly. Doctor. Rourke nodded. Behind them, the hospital lights hummed. The night had not ended cleanly. Nights never did. They frayed, thinned, and surrendered by inches. Mara stepped into recovery with the chart in her hand, and the staff made room without being asked. Not because she demanded it, because the night had taught them to recognize direction when it walked in quietly. Carla Vance lay beneath 3 warm blankets, her face slack with anesthesia, her injured leg supported and wrapped. A nurse stood at the foot of the bed with a Doppler probe pressed near the ankle. The soft, rushing sound filled the small space. There, the nurse said, almost smiling despite herself. Still strong. Mara listened for 1 full second. Again in an hour. If it weakens you, page me before you page ortho. The nurse nodded. Yes, doctor. Mara wrote the note herself. Not because she did not trust the nurse, but because a saved limb could still be lost to a lazy handoff. In the next bay, Miguel Arroyo breathed through oxygen while ICU prepared a bed. His chest tube moved with each breath. Shaw stood beside him, checking the monitor with the stubborn focus of a man who knew a patient could betray you even after the numbers improved. Mara stopped beside him. Gas. Better than expected, Shaw said. Not good. Better. That counts tonight. He looked at her over the chart. You always do this. Do what? Stay until the patients prove you right. Mara glanced at Miguel. No. I stay until they stop trying to prove me wrong. Shaw gave a tired breath through his nose. That might be the most honest thing I have heard in this hospital. Mara moved on. Noah Ellery's room was quieter. His mother sat beside the bed, both hands wrapped around his small fingers. Her shoulders shook, but she made no sound. Noah slept under warm blankets, his cheeks no longer as gray as they had been in the operating room. The dinosaur sticker had been moved from the surgical blanket to the side rail. Mara stood at the doorway. The mother looked up. You're her. Mara did not step closer yet. I am Dr. Keene. You saved him. Mara's gaze moved to the monitor. The team saved him. The woman shook her head, tears slipping down her face. I heard them say he was crashing. Mara entered slowly and lowered her voice. He was very sick. He is stable now. He is still in the fight, but he is not losing. The mother covered her mouth with one hand. Mara waited. She had learned a long time ago not to rush relief. Sometimes people had to feel the floor again before they could stand on it. The woman whispered, "Can I touch his face?" Yes, gently. The mother brushed 2 fingers over Noah's forehead like she was afraid he might vanish. Mara checked the temperature, the urine output, the pressure trend, the latest lab draw. Then she wrote her orders. Behind her, Rourke stood in the hall. He watched without interrupting. The woman looked at Mara again. "Did you have children?" The question came without warning. Jenna, who had appeared behind Rourke, stiffened. Mara's face did not change. "No." The mother swallowed. "You talk like someone who knows what he means." Mara looked at Noah. "I know what it means when someone is waiting outside a door." That was all she gave. She left the room before gratitude could become something larger than either of them could carry. Dawn reached the 3rd floor slowly. The black windows turned blue, then gray. The desert beyond the hospital emerged in flat, quiet shapes. El Paso began to wake beneath a sky the color of steel. The ambulance bay lights were still on, but they looked weaker now, less like beacons and more like bulbs waiting to be switched off. The night shift did not celebrate sunrise. They survived into it. Mara sat in the break room with 5 charts spread across the table. Her coffee had gone cold. She had taken 3 sips and forgotten the rest. Her hair was still tied back. Her shoulders were straight. Only her eyes admitted the hour. She wrote with clean, compact strokes. Every order had a reason. Every follow-up had a time. Every warning was plain enough for a tired intern to understand at 6:30 in the morning with a pager screaming at their hip. Jenna entered first carrying a fresh cup of coffee and a protein bar. She placed both in front of Mara. "Eat." Mara did not look up. "Is that an order?" "Yes." Mara wrote one more line, then opened the wrapper. Jenna sat across from her. For a moment, neither spoke. The vending machine hummed in the corner. Someone had left a pair of blue shoe covers on the floor. A microwave clock blinked the wrong time as if even the appliances had lost track of the night. Jenna watched Mara chew once mechanically. "You scared them." Mara looked at her. "The patients." "No, the doctors." Mara returned to the chart. "They scare easily." Jenna almost smiled. Some of them needed it. Mara capped the pen. "Fear is only useful if it changes behavior." The door opened. Rourke stepped in with Helena Brooks beside him. Shaw followed, carrying his own cup of coffee and looking personally offended by it. Paige Sutton stood in the doorway for a moment before entering. Travis Bell came last. He looked as if he had not decided whether he belonged in the room. Brooks closed the door. The sound was soft. Still, everyone heard it. Mara looked at the group, then back at the charts. "I have 2 notes left." Brooks studied her. "We can wait 3 minutes." Rourke glanced at Brooks, surprised. Mara finished the first note, then the second. She signed both, stacked the charts in order, and pushed them toward Jenna. Carla first. Noah second. Russell third. Miguel goes to ICU when they call. Diane can stay PACU until surgical floor opens. Jenna took the stack. Got it. Only then did Mara stand. Brooks opened the folder in her hands. Western Medical Staffing confirmed your current civilian credentials. Your licenses are clean. Board certification confirmed. Prior hospital privileges confirmed. No malpractice flags. Federal references are pending formal release, but we received enough confirmation to verify that you were attached to a combat surgical unit. Mara said nothing. Brooks's eyes held hers. You made this difficult. Yes. That cannot continue here. No. The answer was simple enough that Brooks paused. Rourke stepped forward. We want you to stay. The room went still. Bell looked down. Paige looked at Mara. Shaw drank coffee and winced. Mara's expression remained unreadable. Why? Rourke did not answer too quickly this time. He had learned that night what happened when he did. Because we need surgeons like you. Mara watched him. You need results like mine. Yes. The honesty landed heavily. Rourke did not look away. Yes, we do. But last night also made something clear. Results like yours do not come from one pair of hands. Not safely. Not for long. We need what you know. Mara's gaze moved to Jenna. Jenna gave the smallest nod. Brooks added, "We are not offering you a myth. We are offering a formal role. Full verification. Full privileges review. Proper structure." Mara looked back at Rourke. "And what happens after the story gets out?" Rourke frowned. "What story?" "Ghost hand. 5 surgeries. Secret military surgeon. Hospital miracle before dawn." The room went quiet. Mara continued. "Someone always wants the story. Administration wants reputation. Media wants a headline. Staff wants a legend. Patients want a guarantee. I cannot work under that." Brooks's face tightened, not in anger this time, but in recognition. "Then we do not sell the story." Bell finally spoke, voice low. "People already know." Mara looked at him. Bell swallowed. "I mean inside. People are talking. People always talk." Paige stepped forward. "Then, teach before the talking becomes worship." Mara's eyes shifted to her. Paige held the look. "You said last night that if I did not know what I was seeing, I should say so. I said that to a resident. You said it to the room." That silence felt different. Less defensive. More useful. Mara looked at Rourke. "If I stay, it is not to be your emergency weapon." Rourke nodded. "Understood. No special hallway treatment. No nickname. No speeches at fundraisers." Brooks' mouth tightened. "That may be the easiest condition anyone has ever given me." Mara raised one finger. "First condition. Trauma simulations. Regular, real-time. Full team. ER to OR. Blood bank included. Respiratory included. Security included if they control doors. No annual performance drill with clipboards and applause. People practice like patients are bleeding." Jenna's eyes sharpened. "Yes." Rourke nodded. "Agreed." Brooks looked at him. "That costs staffing hours." Rourke answered without looking away from Mara. "So did last night." Mara raised a second finger. "Blood response changes. If a patient meets criteria, blood moves before the third phone call. No maze. No waiting for the right person to call the right person while pressure drops." Jenna leaned forward. "I can help build the protocol." "You can lead the nursing side," Mara said. Jenna blinked once, then nodded. "Done." Mara raised a third finger. "Or access and supply readiness. Trauma routes stay clear. Badge readers work. Airway carts are checked. Tourniquets are not decorations locked in the wrong room. If a room is down, everyone knows the workaround before the stretcher arrives." Brooks listened with her arms folded. "That is operational authority." Mara met her gaze. "That is operational honesty." The sentence hung there. Rourke looked at Brooks. "We have committees that have discussed these problems for years." Brooks's eyes stayed on Mara. "And you think she fixes them by force of personality?" Mara answered before Rourke could. "No. Personality fades. Systems remain. I want authority to build the system, not applause for surviving without one." Shaw set his coffee down. "She is right." Everyone looked at him. He lifted both hands slightly. "I am anesthesia. I live where everyone else's delay becomes my airway, my pressure, my dying patient." Last night was not just impressive, it was embarrassing. She was ready in rooms we use every day, and we were not. Jenna nodded. "Blood bank should not require a prayer chain." Paige looked at Bell. Bell exhaled. "Or 4 has been down for 11 days. Brooks looked at him. He seemed surprised by his own courage, then continued. "We all worked around it. Complained about it. Made jokes. Last night, that could have killed someone." Rourke looked at Bell for a long second, then back to Brooks. "We can keep calling these things limitations, or we can call them what they are." Brooks' voice was quiet. "Hazards." No one corrected her. Mara lowered her hand. "I do not need the keys to the hospital. I need people to stop protecting bad habits because they are familiar." Brooks closed the folder. You get a provisional appointment pending final verification. Trauma systems consultant and attending surgeon under expanded review. 90 days. Measured outcomes. Documented changes. No independent policy changes without review. Mara looked at her. Fast review. Brooks held her gaze. Fast review. Rourke extended his hand. This time there was no performance in it. Mara looked at it for a beat. Then she shook it. Her grip was steady. Rourke said, "When can you start?" Mara glanced through the break room window at the surgical board. Day shift had already begun adding cases. New names. New pain. New clocks. I never stopped. Jenna let out a breath that almost became a laugh. Shaw picked up his coffee, remembered the taste, and set it back down. Brooks opened the door. Outside, the hospital had changed shifts without changing its nature. Nurses with fresh eyes passed nurses with hollow ones. Residents checked lists. Families waited with coats over their laps. A child cried in the ER. A man argued with registration. A stretcher rolled in from the ambulance bay, wheels clicking over the seam in the floor. Mara stepped into the corridor. People noticed. They tried not to stare. A scrub tech gave her a small nod. The young resident from Noah's case stood near the desk, eyes red from exhaustion, and straightened when Mara passed. Mara stopped. Emily. The resident looked startled. "Yes, doctor. You did good work." Emily's face changed completely. Not pride. Relief. "Thank you. Get breakfast. Then write what you saw before memory turns it into a story." Emily nodded quickly. Mara continued toward the window overlooking the ambulance bay. Rourke joined her there. Below, 2 ambulances sat with their rear doors open. A paramedic leaned against one of them, head bowed. Evan Rusk. He looked up and saw Mara at the glass. He did not wave. He only stood a little straighter. Rourke looked out over the bay. Why, Coyote Ridge. Mara watched a nurse guide a frightened family through the sliding doors. Your people listened. That is it. That is rare. Rourke absorbed that. After a while, he said, "I asked who you were." Mara did not look at him. "Yes, I think I asked the wrong question." She turned slightly. "What should you have asked?" Rourke looked back at the hallway at Jenna, already speaking with blood bank at Shaw, correcting a resident's handoff at Page, pulling Bell toward the supply room instead of away from it. What do we have to become to keep up? Mara looked through the glass at the morning. For the first time, the almost smile appeared fully enough to be seen. Ready. The trauma pager chirped at the nurse's station. Not a scream. Not yet. Just a sound. Mara tied her cap as she walked back toward the surgical wing. Rourke followed. Jenna was already moving. Shaw took one last look at his coffee and abandoned it with no regret. Page grabbed a chart. Bell opened the supply cabinet before anyone told him to. No one called her ghost hand. No one needed to. The hospital doors opened again, and Coyote Ridge leaned into the day.